Hey, it's Rebecca Smith from the KBIA newsroom in Columbia, and it's time for Missouri Health Talks, a project where we listen in on Missourians' conversations about access to health care. Recently, the Boone County Commission approved $2.5 million in funding from the state of Missouri to construct a childcare center specifically for Boone County first responders and other public safety employees. So this week we hear from Kip Kendrick. He's the presiding commissioner of Boone County and spoke about the center's mission to address barriers to employment for public safety employees through providing access to affordable childcare. Here's Kip.
So this is a new venture for us. Boone County government has not been in the childcare business, but we know just nationwide we're kind of at a crisis level on access to childcare and certainly affordability issues with childcare. And then when you look at like our public safety personnel, our first responders, those issues are exacerbated. Take for example our Joint Communications Center. About a year and a half ago, we were really staggeringly low employment levels. We were about 19 dispatchers. Today we're over 43, and we've got a new group starting soon, and so pleased with where those employment levels have gone. But we also know we haven't quite crossed that hump yet on how do we make sure that we can get to long-term sustainable staffing levels within joint communication. So we want to address certainly the access portion of this, right? Having access to a public safety child care center on our public safety campus for our law enforcement personnel, our jail detention officers, and then our joint communications, which is all right there in the same location. So it's access, and then it's affordability as well. And so we're going to find a way to subsidize the cost of this and bring it in below market rate. We certainly believe that it will help on the recruitment side, recruiting not only 911 dispatchers, our sheriff deputies, our jail detention staff. So we believe it's going to help on recruitment, and then certainly the retention piece of it. It's a creative way of addressing a very real problem for young families, for young professionals trying to make a career happen while also running into the very real barrier of access to childcare. And so we believe that it's going to be not only help on the recruitment, but we expect that retention side will go up. Anecdotally speaking, we'd expect at least maybe 5 or 6 year, potentially longer retention for those individuals who have children at the center. And so, we think it's going to be an important tool. And, this day and age, employers have to be creative, and this is a way, especially on our public safety side with the critical nature of first responder jobs, that we can be creative in such a way that increases public safety across Boone County. So data collection is going to be really important for us, and certainly as a public entity, we want to make sure that we can collect that data and then share it back out as a resource to other counties, to other municipalities, not just in the state of Missouri, but across the nation. And that will certainly be the mission of this as well, is how do we provide that that model for others to try to emulate, and how can they learn from our success and our failures along the way.
That was Boone County Presiding Commissioner Kip Kendrick speaking about how employers can use creative solutions to address barriers to employment like childcare availability. That's it for this week's Missouri Health Talks, which was reported and produced by Anna Speidel. Tune in next week for more conversations from throughout the state about health and access. I'm Rebecca Smith. Thanks for listening.